And so this is what we are doing. We are taking people into a chamber. We call it a suite. You sit inside. We are compressing the air to 2 atmospheres. And then we give the oxygen by mask. By doing that, we are increasing the blood oxygenation from 100 mercuries to 1600. At this level, the amount of the dissolved oxygen is sufficient for all the energy demand of the body. We don't need red blood cells. So oxygen can be delivered even at the location where the blood cells cannot go. So that's one thing. And then the real trick is that per a protocol that we define, people are being asked to take the mask off while they're in the chamber. And when they're taking the mask off, there is an abrupt decline of the oxygen from very high, from 1600 back to the normal. And then we are going up and down again, and we have also the gap between the session where you are back to normal atmosphere. And that fluctuation in oxygen is being sensed as hypoxia at the cellular level. And then the body activates all the things that usually happen during hypoxia in hyperoxygenized condition. The stem cells proliferate, blood vessels start to generate. This is what we call the hyperoxic hypoxic paradox.
Hello, Dr. Efrati. You are a professor at Tel Aviv University, the director of the Segal Center for Hyperbaric Medicine and Research, and co-founder of Aviv Scientific, as well as the author of the recently published book, Beyond Normal, How the Science of Enhanced Medicine Elevates Peak Performance and Repairs Brain Injury. So welcome to Modern Healthspan, and thank you so much for joining us today.
Thank you, Richard. I'm happy to be here.
So, Dr. Efrati, so you're a pioneer in the field of hyperbaric oxygen therapy. And I'd like to start there to kind of discuss some of your work. So could you tell us what drew you to the technology in the first place?
So actually, everything happened, the big things, the innovation things usually happen by mistake, because if it's not a mistake, then it's not innovation, because when you decided that you want to do something, you have a database, but everybody has this database. But if things are not going the way it's supposed to be, and then you find something unexpected or find yourself in a territory that was not intended from the beginning, that's how innovation starts. So I never intended to deal with hyperbaric medicine. Actually, my basic research was related to malignant hypertension. Malignant hypertension is a condition when the blood pressure is abruptly going very high, and then different organs within our body are starting to die. The most sensitive organ are the brain and the heart, and that's what we call malignant hypertension. It's a life-threatening event, and I wanted to investigate that and to understand what are the biological cascade, what genes expression are happening during that period to understand better what's going on. So in order to do that, we have built a simulator of pressure that we can enforce the pressure on the cells. And then I realized that any change that we are making with the pressure and the kind of gases that we utilize have an unbelievable biological effect. And that brought me to dealing with what we call hyperbaric medicine. And to put things in perspective, usually in medical school, we've been trained, to give medication, chemical entities, in a pills, by injection, etc., etc. And we also been taught how to use the knife, to do a surgery, cut this, stitch this, and that's the other tool. And in hyperbaric medicine, what we are saying, we want to utilize the environment in order to achieve biological goal. We want to utilize changes in environment, changes in pressure, changes in gas concentration in order to achieve this goal. That's hyperbaric medicine. But within that field, there are huge amount of protocols and indication that you can use, and one is not relevant to the other. Just like you will say that I'm taking a pill for headache, I'm taking a pill for blood pressure control, I'm taking a pill for infection. Every pill is totally different. From somebody who looks from the outside, said, you're taking a pill. And also with hyperbaric medicine, you use the environment, you use a chamber, but the protocol is completely different. That just like different pills are completely different. Is that point clear? That's hyperbaric medicine in general. Now, within that field, there are indications where you use the pressure as the active ingredients. For example, the bends. If somebody is diving, going up very fast, you have bubbles, you need to shrink the bubble, you're using high pressure, you don't use oxygen, you use the pressure. This is one indication. Other category of indication is that you are giving the oxygen as a treatment. For example, CO intoxication, which is smoke inhalation. You smoke is going in with the CO. The CO is competing with the oxygen on the location where the oxygen is supposed to be transferred and metabolized. So what we are doing, we are using the pressure in order to compress more molecules of oxygen per square, more is going into the lungs, to the bloodstream. And by doing that, we can compete with the CO. And there are other acute indications where we need oxygen, where the tissue is suffering from lack of oxygen supply. This is the second big category. And what we are doing, and that's in continuation to what we spoke before, we were thinking how we can induce regeneration. How can we induce the repair mechanism, which is something that we investigate a lot. My team is working with what I call thermodynamic. It sounds like a frightening word, thermodynamic. But what it actually says is open the bottlenecks, find the bottleneck, biological bottleneck, open the biological bottleneck, and let the tissue work. So we were thinking, what do we need for regeneration? What do we need in order to induce repair mechanism? So in order to induce repair mechanism, we need stem cells. We need cells that can differentiate into the missing tissue. We need angiogenesis, generation of new blood vessels, because this is the access road to the tissue that we want to repair. You want to build a house. You cannot build a house unless you have a road that will bring you to the location where you want to build the house. And so these are the blood vessels. And we need metabolic function that enable that, mitochondria function that will be better. And we said, okay, so that's the list of the major things that we need. But how can we do that? How can we induce that? And again, we are thinking, first of all, in large. We said, what is the most powerful trigger that our body has that induce all of this repair mechanism cascade? And the most powerful trigger that our body has to induce regeneration is hypoxia, is lack of oxygen. Because evolution perspective, anytime we don't have oxygen, the body knows that there is a problem because you don't have oxygen. So a damage was going somewhere along the way. So by triggering the hypoxia, but by sensing the hypoxia, the body triggers all the repairs that we spoke about. Stem cells proliferate, migrate, new blood vessels to generate, new tissue to be built up and replace the damaged tissue. So I said, okay, that's clear. So can we take a person, hold his breath, stop his heartbeat, we will have hypoxia? Will that induce? The answer is yes, but there is only one problem with that. This is not exactly healthy, and you will actually need the repair mechanism. And then we were thinking what the body actually sense. Does the body sense absolute values, or does the body sense the delta, the fluctuation? It happens to be that there is no absolute in nothing. Nothing is absolute. Everything is relative. Okay, I will feel that I'm tall or short, not based on my actual height. That depends on my location. Okay, if I'm living in Finland, that will probably be very short. If I'm coming to you and visit you in Hong Kong, I will probably be average plus. Okay, so everything is relative. And we said, okay, let's see if we can take advantage of that. Let's increase the oxygen to very high level and then do a fast decline back to the normal, in a way that this decline from very high back to the normal will be sensed at the cellular level as hypoxia. And that took us only 6 years of research and optimizing the protocol. Now it sounds easy, but when you're doing that, you're saying, okay, let's try this, try this. And so this is what we are doing. We are taking people into a chamber. We call it a suite. You sit inside. We are compressing the air to 2 atmospheres. And then we give the oxygen by mask. By doing that, we are increasing the blood oxygenation from 100 mercuries to 1600. At this level, the amount of the dissolved oxygen is sufficient for all the energy demand of the body. We don't need red blood cells. So oxygen can be delivered even the location where the blood cells cannot go. So that's one thing. And then the real trick is that per a protocol that we define, people are being asked to take the mask off while they're in the chamber. And when they're taking the mask off, there is an abrupt decline of the oxygen from very high, from 1600 back to the normal. And then we are going up and down again, and we have also the gap between the session where you are back to normal atmosphere. And that fluctuation in oxygen is being sensed as hypoxia at the cellular level. And then the body activates all the things that usually happen during hypoxia in hyperoxygenized condition. The stem cells proliferate, blood vessels start to generate. This is what we call the hyperoxic hypoxic paradox. Our main focus is on the brain because the brain is the most challenging and probably the most important tissue. And it happens to be that even in the brain, we have stem cells. We call them neuronal stem cells. They are located in a place in the brain we call hippocampus in the periventricular area. And by doing this fluctuation, these stem cells start to proliferate and then they are migrating. And then for the first time, we can see angiogenesis and neurogenesis in the brain, which is, of course, exciting. It doesn't happen, of course, only in the brain. It happens also in other tissue. For example, 3 months ago, we just published another article from our aging population on which we did cardiac MRI. And we can see that the same angiogenesis that we have in the brain also happen in the heart. You have more blood flow in the heart as the result of that. And doing that, then the cardiopulmonary exercise test is improving. The maximal capacity, the aerobic, the anaerobic threshold is improving. And this is quite exciting because we can actually open the bottleneck, induce the repair mechanism, and get results at the tissue and the clinical part that is related to that tissue that is being improving.
So if we go...
Sorry that I spoke too much.
No. There's a lot to unpack in there. Yes. So if we go back to the kind of the mechanism, so what is actually sensing this oxygen change and kind of initiating the cascade?
At the cellular level, we have a promoter. The name of the promoter is HIF. HIF stands for hypoxic-induced factor. There are 3 Nobel Prize winners from 18 months ago on the HIF. So once there is hypoxia, HIF is going up. And once HIF is going up, it's a promoter, means that once it's going up, there is a whole cascade of genes that will be expressed. VEGF, vascular endothelial growth factor, that is inducing the generation of the new blood vessels. The mitochondria start to proliferate. The stem cells are being sensing that, and you activate their replication, their ability to proliferate and migrate. So hypoxia or fluctuation from very high back to the normal, repeated. If is going up, a whole cascade of genes that supposed to induce the repair are being activated, and then you have those results as a consequence.
So one of the things you mentioned that I didn't really realize, because you only have a fixed set of hemoglobin. So even if you're breathing compressed oxygen, you can't absorb more oxygen. So it's like it's directly absorbed into the blood. It's not carried by hemoglobin. Is that correct?
Yeah, you're absolutely right. When we are going to hyperbaric environment, actually we are playing only with the dissolved oxygen. Oxygen is being carried in the blood in two compartments. One compartment is when it's bind to the hemoglobin, which is like a truck that carry the oxygen. And the element is free dissolved oxygen molecules in the plasma, in the blood. And when we are in hyperbaric environment, we are playing only with the dissolved oxygen. The part that is bind to the red blood cells or to hemoglobin is not relevant at all. So we are not playing with it. We are not utilizing it.
Interesting. So, right. So that's how you can get to kind of other areas of the body that don't have enough oxygen, that can't get, I guess, that don't have sufficient blood flow.
That's, by the way, a major part, a major element, a major bottleneck that happened to us along the aging process. Just like the pipe that we will have at the house, a long time, the pipes are being occluded with what we call choroida. And choroida at the blood cell level, at blood vessels level, this is atherosclerosis. And once you have this occlusion, whatever come after the occlusion, after the choroida, will suffer from lack of oxygen supply. So increasing the stem cells is not sufficient because you have to bring the needed environment so these stem cells can proliferate and grow and replace the missing tissue. So if we are going to 2-ATA with 100% oxygen, the oxygen is going by diffusion. Even if the red blood cells cannot reach that point because of the occlusion, the oxygen will be going there by diffusion. And then you have the land and you have the plant, which is the stem cells. You have good land, flourish land with the stem cells, the plant, and it's growing.
Time flies. It's almost the end of 2024, but it's never too late to prioritize your health. There's still plenty of time to make a positive transformation before the new year. Every little step counts. Did you know that eating healthier can lead to notable results in just 1 to 2 weeks? Regular workouts can make a significant difference in 8 to 12 weeks. And improving sleep quality can be felt in as little as 2 weeks. A basic nutrient like magnesium is crucial for overall health. I personally use Magnesium Breakthrough by BiOptimizers. More than just a supplement, Magnesium Breakthrough is a comprehensive formula containing 7 forms of highly bioavailable magnesium. It's scientifically designed to improve sleep quality, enhance workout recovery, and boost muscle growth. Imagine the progress you could make in the next 90 days. We challenge you to make the most of this time. Combine Magnesium Breakthrough with your health and fitness efforts and see how far you can go. To help you get started, BiOptimizers is offering a special 10% off Magnesium Breakthrough when you use the code MODERN10 at BiOptimizers/modern. Don't let another year pass without reaching your health goals. Do you have any concerns about cancer, or do you screen for cancer before? Because it seems you're going to be promoting a lot of kind of pro-growth factors with this system.
Cancer is a very good point because as we know today, I'm speaking now about solid tumor, not hematopoietic tumor. What's unique to the cancer cell is that the cancer cells are doing anaerobic fermentation of glucose, meaning the metabolism of the cancer cell is not based on oxygen. The metabolism of cancer is based on glucose per se. That's, by the way, one of the reasons when we are doing PET scan to screen for metastases, what we are injecting is FDG, which is actually glucose. So you inject glucose and see where the glucose is going. And the places where you see the glucose, this is, you're saying, okay, there is a metastasis over here. Not because you see the metastasis, you see overutilization of glucose. So if we are looking on cancer cells are compared to normal cells, the cancer cells have advantage over the normal cells in hypoxic environment, in oxygen-deprived environment. This is, by the way, one of the reasons why, if you will look at it, all the risk factors that are related to cardiovascular disease are also risk factors for development of cancer. Okay? There is quite similarity between the two. And if you will take, for example, a cancer cell, and you will take the mitochondria out of the cancer cell, the mitochondria, this is the organella that doing the anaerobic fermentation of glucose, and you will replace it with the normal mitochondria, the cancer will not be cancer anymore. And if you take the mitochondria and implant it in normal cell, the normal cell will become cancer. And this is the Warburg effect, the utilization. There is a Nobel Prize of it. Okay, that's anaerobic fermentation of glucose. So when we are actually increasing the oxygen, the cancer cell lose this advantage that they have in hypoxic environment over the normal cell. So we can say clearly, because hyperbaric treatment is being used all over the world for post-radiation injury. People who have cancer get radiation, get injury because of this radiation. So millions are being treated for that. We can say clearly that hyperbaric oxygen therapy does not cause a growth of the cancer cell. We can say that clearly. What we cannot say yet is whether this treatment can be beneficial as part of the Armageddon tool that we have against cancer. The reason we cannot say that is because we don't have clinical trial yet that evaluate that. So to make a long story short, the treatment that we use, the protocol that we use, clear-cut doesn't cause the tumor to grow. Whether this treatment can be an additional therapy that helps you prevent cancer, we don't know, even though in our study, we see a decline in the senescent cell. You familiar with what senescent cells are?
Please explain, but
Okay.
yeah.
So if I'm taking cells in the lab, this cell, optimal condition, okay, in the lab, medium, I control all the stuff. This cell will replicate something like 40 times, and then they will stop the replication. They will get stuck. And these cells are malfunctioning. They accumulate mutation, and these cells are the cells that can be transformed to be cancer cells. Why they are doing that? There are several reasons. One of the reasons is the telomere that shrink. Telomere is the bumpers that we have at the tip of the DNA that's supposed to protect the DNA. And every time the cell is splitting, and we have now two cells, during this process, the DNA is exposed and the bumpers get hit. So they are shortening. And this, along life, we have shortening of the telomere. So in our study that we did on normal aging population, for the first time in humans, we were able to demonstrate that with the hyperoxic-hypoxic paradox protocol that we use, the specific unique protocol that we use, we have elongation of the telomere and decline in the senescent cell. Meaning the aging, malfunctioning cells that can become cancer are declining because of that. We demonstrate that in blood sample, and we also demonstrate that in skin biopsies that we did in order to see what happened in the tissue. So one can claim that that reduced the risk for cancer. True, but we haven't had an endpoint or enough follow-up to demonstrate that cancer is declining. But coming up again, it clearly doesn't cause the cancer to grow. We don't have data yet to say anything whether it's a powerful treatment tool against cancer or in preventing cancer.
Right. But it did reduce the senescent burden in humans. So do we know, does it cause the senescent cells to die, or does it just stop them being formed in the first place? Or do we know why?
So we don't know why. We know the end result. Okay.
Right.
The end result is quite exciting. As you know, reducing the amount of the senescent cell is one of the holy grail that we look for in aging biology or improving the aging biology. So we don't know the reason. It might be possible that we are enabling the clearance of them in a faster way. But we do know that the new generation of the senescent cell will be declined because the telomere are being elongated.
Yes, which is interesting because that requires telomerase and
there are other mechanisms as well, not only the telomerase.
Okay.
But we won't get into that because otherwise we will lose all time.
Yeah, that's probably too detailed. Yes, well, it's definitely too detailed. So we'll come back to aging. Yeah, but if for, I guess, normal indications, like maybe a wound or something, how would a person come to one of your clinics to go through HBOT, and how would that kind of work?
So if somebody come with a wound, with an injury, whether it's a wound in the leg or whether it's a wound in the brain, both are wounds. The first is we need to evaluate and characterize the wound in order to know whether the individual can benefit from the treatment, yes or not. So if it's a peripheral wound, we will look at it and we will measure the oxygen level in that wound bed, okay, to see exactly what's going on over there. Generally speaking, the scale of injury can range between necrosis. Necrosis is a totally dead tissue that is lost. In this tissue, we cannot help, to a malfunctioning tissue, meaning you have the infrastructure, however, the tissue is not functioning in the way it's supposed to be. Unfortunately, where we have necrosis, when the tissue is totally dead, we cannot help. And if it's in the brain, the necrotic tissue will be replaced by fluid. We cannot help because we don't have the infrastructure on which the stem cells can be delivered and the blood vessels can be generated. The metabolic dysfunction tissue, this is where we help. We have the anatomy, we have the infrastructure, and on top of this, we can improve that tissue. In the brain, we can demonstrate or evaluate to see whether we have such a tissue by doing a combination of two imaging. One of them is anatomical imaging of the brain, which is a standard MRI or a CT scan. And the other one is doing metabolic imaging of the brain. We can do PET, we can do perfusion or functional MRI to see the network, how it works. And after doing that, we can see which areas can improve. And based on this, we can set the expectation with the patient and tell him, I think that your hand will move, the leg not. If you want, get the treatment. If not, not, etc., etc. So this is part one. In addition to that, we also need to evaluate the patient itself to see that he can go in a safe way into the hyperbaric environment, that it doesn't have any contraindication. After doing the evaluation, then the treatment start. For different indication, there is a different protocol, but if we will take the brain, which is the innovative things that we bring to the table, with regard to the brain, if we want to induce significant neuroplasticity, significant angiogenesis and tissue repair, we are speaking about 60 sessions, 60, daily sessions. It's 2 hours each sessions, 5 days per week. So it's not a magic. It takes time, just like a wound that needs to be repaired. And that's the needed stuff.
Right. Yeah. And I like the way you, in the book, you always talk about the brain as tissue and how you're actually seeing the difference in the perfusion, in the, I guess, the blood flow in the brain. So it's not like filling in a questionnaire and saying, oh, I feel better. It's, you can see that the other pieces of the brain are now lighting up.
Indeed true. We need to evaluate everything objectively. Everything. And also the cognitive, this is your score in memory, in attention, in information processing speed. This is your VO2 max. This is your anaerobic. Everything should be evaluated objectively. And, you cannot treat blood pressure unless you measure it. And you cannot treat the brain unless you measure it. And see per yourself what is the optimal protocol that you benefit from and in what way. And more than that, after finishing the treatment, you need to do a follow-up to see that the results hold and how long they hold. And if at a certain point, of course, we are aging again, if at a certain point, 2 years, 3 years afterwards, you have a decline, then we need to quantify it and decide what we're going to do about it.
Yes. So you did mention contraindications. What kind of thing would be a contraindication for using HBOT?
Like any other treatment, there are contraindications to the treatment. The contraindication can be related to the organ that actually sense the pressure. The ears, for example, you will feel the pressure, you need to equalize. And there are several inner ear pathologies that are incompatible with the pressure, and that can be served as excluded criteria. There are some lungs pathologies that are also incompatible with the pressure. And in the brain, if somebody has active epileptic location, since we are activating the brain, we are activating the electricity in the brain, and we may activate the epileptic locus. So that can also be a contraindication. Generally speaking, if you've been evaluated by a professional, the treatment is very safe, but you need a professional to evaluate you at the beginning before you are starting with the treatment.
Yes. Yeah, I saw that was one of the things. Yes, you talk about the professional evaluation, but also the checking the whole patient, right? Doing all the measures before and looking for what the outcome is going to be, and then completing and then measuring at the end as well.
Absolutely. Absolutely. If you want to treat something, you need to measure it.
Yes.
If you cannot measure it, so how do you know what you're doing? And even after measurement, you have to set the expectation. Okay, if my biological expectation will be for myself that I want to have blue eyes and red hair, probably I cannot achieve that. So that's not something that I can help with. And if the expectations are set, and you need to be able, based on the basic evaluation, to predict in good enough quality what's going to happen, you sit with the individual, you tell him what you think may happen with the treatment, and if it's a good enough cause for him, that's the goal. And no matter what the goal is, unless everybody is on the same page, it's a good enough goal.
Yes. Yeah. So you mentioned that you ran a clinical trial with, I think it was healthy older individuals. So actually, a couple of questions in there. So one is, what did you see? But kind of before that, uh, do you have older, basically older, healthy people coming into your clinic who want to be better? And what percentage of your customers would that be?
The percentage is us to define. So we have around in Israel, for example, we are treating around more than 300 clients per day. Okay, I cannot call them patients because if you are healthy or
Hmm.
at normal to your age, then you are not considered to be a patient.
Hmm.
Okay, you are according to your age. Of course, we all want to be much more than our age, and that's the beyond normal. Normal is really not relevant when you speak about you, about myself. We don't want to be the normal for our age. We want to perform to the better that we can, unless you below the normal. So that's us to define. So in Israel, that's the amount that we treat. In the affiliated Aviv clinic in Florida and Dubai, actually most of the patients are coming in reverse aging indication. Most of the patients have age-related functional decline. Even though if they be above normal, it's age-related functional decline as compared to themselves.
Mhm.
And today, people just don't want that. We want to function. We want our brain to function. We want our cardiovascular function. We want our sexual function. We just want to function. We want to continue to enjoy to this world. And we don't take it for granted anymore that we're supposed to decline. Okay, we suppose a lot of stuff, but why not?
Mm.
Okay, why not to continue and enjoy the journey that we came to this world with? It's a beautiful journey, as long as you enjoy the view and feel the air on your face. If you are locked down in a closed environment, dark, you cannot communicate, that's a
Mm.
journey we don't want to be part of. So today, more and more people understand that they need to manage their health. Generally speaking, you have two options, is whether you are managing disease
Mhm.
or whether you are managing health. Managing disease, it's easy. You had a stroke, you need a treatment. You had a car accident, traumatic brain injury, you get a treatment, and then people are committed to do whatever they can. But managing health is not less important.
Mhm.
And if you are professional, you need to manage your health and you need to invest in your health. Invest the time and the resources in your health. That's how it is. If you will take, for example, professional Formula One driver, okay? They are in the race, every minute, every second count, but still they are making a stop at the pit stop.
Mhm.
Okay, they are losing time at the pit stop. No, they are not losing time because they know that if they will not do that, the tire will be damaged, they will have an accident, and the engine will collapse. So they are professionals, so they are making a stop at the pit stop. And if we are professional to our body, at least to the level that we are professional to our car, we should have a pit stop. We should invest in our health before we have the collapse. And
Mhm.
that's the appropriate way to do it. And more people understand that and refer to themselves as professional, and they're doing the best to manage their health and be active about it.
Yes. So you did. So you did do a clinical trial, right, with these healthy older people. So, and you kind of referred to it a little bit before. Could you talk in a bit more detail about what you saw? Because I mean, it's like improved VO2 max and improved cognitive performance.
So what we have done we call it the reverse aging study. We have took individuals, healthy individuals, age 65 or older, no stroke, no diabetes, no significant cardiac problem, us, fully functioning, non-obese, standard, active, enjoying life population. And we randomize them into two groups, the hyperbaric and the standard, the way they live. We haven't changed any other thing, just the hyperbaric. And before starting the protocol, we evaluate whatever we can. With regard to the brain, we did MRI, including DTI perfusion. We evaluate the cognitive function, memory, information processing speed, all of that. Cardiac function, cardiac MRI, cardiopulmonary exercise test, skin biopsy, senescent cell, telomere, everything can be evaluated before and after. And what we were able to demonstrate in that study is not that we are slowing the decline, slowing the expected cognitive declines, slowing the expected physical performance decline. What we were able to demonstrate is that we can actually improve it. We can actually take the biology back in time. And we can see that again in objective measure. If it's related to the brain, you see it in the perfusion and DTI MRI. You can see the improvement in the computerized cognitive test. You can see the improvement with cardiac MRI. You can see the improvement with cardiopulmonary exercise test. You can see the improvement with skin biopsies, with blood tests. You can actually see improvement, not slowing decline. And this is very exciting because in humans, not mice, not rats, even though we have also studies in those animal models, but in humans, we can actually see that we can take the biology and the functionality back in time. So that's the reverse aging program that we have and the reverse aging research that we done before.
Interesting. And that's a published paper. I can.
Yeah, you can read it. Yeah, there are several papers with regards to that. So people can just write my name, Efrati, and aging, and they will read the articles. Yeah.
On PubMed. Okay, excellent. I will find those and put some links in. So in your book, you talk about the principles of kind of beyond normal, right? So actually, that's the title of the book, Beyond Normal. And as you said, like, we don't want to be normal. We want to be, I don't know, super normal. Beyond normal.
We want to get the best of the biology that we have.
Yeah. And so you talk about looking for cellular bottlenecks, especially with respect to aging. So what kind of cellular bottlenecks are we going to see with aging, and how would you try and address those?
In life, generally speaking, we have three major periods of life. You have the time when we are children, kids. We have the reproductive period where we're supposed to bring the next generation to this world. And then we have the post-reproductive period. Now, generally speaking, all species in nature, after the reproductive period, are either being eaten or dead. Because they are, from nature perspective, they are kind of disposable because you don't need them anymore. You don't bring the next generation, so you just take resources without bringing benefit to your species. However, when I'm saying we, I'm speaking about Homo sapiens, humans. We are the only generation that continue to live a significant period of time after the reproductive period. There has to be a meaning for that because otherwise we wouldn't have become the rulers of this world if it wouldn't be so. And one of the reasons is that along aging, we are gaining a lot of knowledge that is highly important, knowledge and wisdom that comes together, that is highly important for the young generation. For example, if you are a tribe in the jungle, you don't know what to do, you will go to the oldest and ask them, what should I do? And they will tell you 20 years ago, we had that and that, we did that, it was successful, and do it again, or was not successful, don't do that, do something else. So that's the importance of the knowledge and the wisdom that we gain in online. However, if we are looking from biology perspective, in each of these periods, there is a balance between regeneration, the ability of the body to build and repair, to degeneration, things that takes us down. Of course, once you're out of the factory, a car or us, we have degeneration. So when we are young children, pre-puberty, the amount of stem cells that we have is huge. We have a lot of stem cells, very potent. The blood vessels are very potent. And the net balance is toward regeneration, towards buildup. And indeed, everything is growing, okay? The body is growing. If I have injured my hand, broken bone, it will be healed in a very fast way. So that's the first period. The second period, the reproductive period, during that period, we have stem cells, but less. We have, they're potent, but they are less potent. We have blood vessels, but the occlusion starts, the atherosclerosis, they are less often. So the net effect during the reproductive period is a balance of stability, more or less. And when we are bypassing the age of 52, 51, then the net balance, when we are reaching the post-reproductive period, the net balance is towards down. Stem cells start to go down. The blood vessels are not patent as they used to be. So the perfusion, oxygen supplies, nutrition supply to the tissue is going down. So the net effect is going down. And we can see that if we have an injury to the skin, the same injury, if we had it during pre-puberty, it will be fast healing. After reproductive, it will take time, if at ever, to heal. So that's the bottleneck: stem cells, blood vessels, and mitochondria function. The mitochondria are the energy generator within the cells. So if I need to mark three major bottleneck, biological bottleneck, those will be the first bottlenecks. And that's what we are addressing with the unique protocol of the hyperbaric, what we just discussed, the hyperoxic hypoxic paradox. And what is very interesting in bottleneck perspective is that it's a never-ending story. Because once you open one bottleneck, then you reach the second one. And when you reach the second one, you will have the third one. So luckily, we scientists and researchers will always have something to do because we just opened the first, we just opened the second, we just opened the third, and so on and so forth. So we will always want to improve our biology and find the next bottleneck that we want to open.
Right. Yeah. So one of the things I saw that you talked about for when you're, for, I guess, remaining healthy was to be needed. And the importance of that. I mean, it's almost like it was your number one thing, more important than some of the other things like diet and exercise. But I mean, if we were to look at a regimen, like what's your regimen for maintaining health?
So as you said, indeed, the most important thing is be needable. We spoke about the 3 periods of life. Okay. If you are needable, nature will try to keep you, okay? If you're needable and you plan a future, then your biology will say, okay, I have a mission. I need to be prepared for the mission. And if you don't have a future, then you're lost because everything will go down because you don't have any more triggering to your body to be prepared for the next. And when people ask me to explain that, and that's you hear from somebody like me who's dealing with physiology, imagine yourself going in a dark street and you have a corner and you don't know what happened around this corner. So what the body is doing, increasing the heart rate, increasing the alertness, Your blood pressure will be better controlled. Your adrenergic system is, because you are being prepared to the next turn. The same over here. If you are planning a future, your body will try to do its best to reach your plan. If you are not doing that, you're lost. Nobody can help you, not even me, because you doesn't have a mission that you need to accomplish, and the body is lazy. You will not do anything. It's lost. So being needed is crucial. And then people ask, how do I know that I'm needed? I say it's very simple. If there is a day or 2 days that you're not going out of your room and nobody calls you and asks you, hey, where you are? I need you. Then you're lost. It doesn't mean that you need to do a world peace. You have to be needed for small stuff. Somebody that wants to play cricket with you, somebody wants to play golf with you, grandchildren that are waiting for you, you teach something, you needed by somebody. Okay, so that's a crucial element. Always design a future. Okay, always plan. Many people ask me what is the definition of an old man. They expect me to speak about telomere, about senescent cell, about stuff. My definition of an old man or person or whoever is old is an old person is somebody who looks backwards. If you will speak with an old person, he will tell you, I used to do that, and I did that, and I did that. If you're speaking to a young individual, he will tell you, I'm planning on doing that. After I will do that, I'm planning to do that. And I just had a discussion with, I will not say his name because he's very famous. He's at the age, he's almost 100, and I was sitting with him, and he just told me, I'm planning on figuring out how we can build a building in a better way on the moon. And then if we can do that, we will think about how we can build the building in March. I said, really? He said, yes. I just have this, and then because we're gonna do that, and we're gonna do need that. So he's living the future. And when I heard that, I said, no problem. Don't worry. I'm with you. We will take care of your biology. That's the easiest stuff. You continue to think on the thing here that you're doing. We will try to catch up with your mission. But it hasn't to be in that level. It can be small things, okay? I'm planning on doing that. After that, I will do that. Always have a future. So this is the first and most crucial thing. Other thing that are important, if we are going to the gas station with the car, you would not put junk in the engine. Because you know that if this oil is dirty and not good enough, the engine will lost. So we should respect our body in the same manner. We should not put junk in our engine. Meaning, don't smoke. It's so ridiculous to smoke. Really, you're taking all of this terrible thing into your body. Why you are doing that? Okay, eat normal food. Okay, I don't want to say the word healthy. Don't put junk into your body, just like you are not putting junk into the engine. Okay, so that's crucial. Second thing. The other thing is challenge your physiology. Meaning, when you are doing exercise, you are telling your body, I want you to be fit to this level of activity. If you will do it once, the body said, okay, it was a crazy for one day. There's no reason for me to invest in building up muscles, building up blood vessels, building up bones, because it's happened only once. But if you will do it a couple of times per week, 3 times per week, then the body said, okay, this crazy guy, he challenged me all the time. I need to be prepared because he's going to do it again, and he's going to do it again. So I need to make myself prepared to that. And then we will see the muscle going up. We can see the bone going up. We can see the brain going up. Okay. So challenge your body, challenge your cognition. okay? Challenge your physical performance, challenge all the time. And if you have these core elements and you do that and you still want to get higher, then that's the place where our team come into the game. Okay. Okay. So let's see how we can do even better than that. And you need additional program and additional professional, just like an elite athlete need professional to train him to get the Olympic medals. So that's the thing. Most of the thing we can practice ourselves.
Okay, so if somebody was interested in reaching out to you or using your facilities, how would they do that? What would they do?
So the name of the network is Aviv Clinics. Those are the clinics that our team is working in, okay, with the standard that we have, and people can apply. We have centers in the US, we have in Israel, we have in Dubai, and soon there will be additional location that will be built up. A center like this have a multidiscipline team. In addition to physician who is specialized in the field, you have physiotherapists, physiologists, neuropsychologists. We can do all the brain imaging and all the high grade things that we just discussed. There are additional hyperbaric centers, but people should be extremely cautious from going into tubes, going into sacks full of air, what people call private hyperbaric chambers or home use hyperbaric chamber. This is absolutely not it, okay? Not it at all. It's not the protocol. And worse than that, they don't have the quality assurance needed to make sure that your air, the air that you have inside that is coming out of a compressor is in the quality that is needed. It's not going infected. It doesn't have CO inside it. If something happened, there is somebody to assist you. And there's a lot of accidents that happen with this crap, okay? I know that they are using my name, putting my face on. This is absolutely not it. And we all know that we are living in a world where there's a lot of fake going around, and in Facebook, people can see a lot of stuff. And the challenge today is to be able to differentiate between what is real and what is false or fake or true. And this is a challenge. So if you want to get a treatment, you have to do it in appropriate place. It's not a tube. It's not a sack full of air. It's actually facility with physician, with nurses. You sit in the chamber with a tender, not by yourself. You have a mask that you can generate the fluctuation. You have the quality assurance. And that's the way to do it. And don't play with your health. Just don't play with your health. And if you don't have this quality of treatment that is needed, the medical grade quality of treatment, just don't do it. Don't take your risk. Don't risk your body with the tube or with the sack full of air.
Right. So you're still researching HBOT. Is there somewhere people can go to see? So I guess a couple. So what are you currently researching? And so what's the projects you're working on now? And is there somewhere people can go to see your latest release? I guess
so
publishing.
With regard to what we are doing, people can just write Aviv Clinics and they will see the facilities and what we are doing. With regard to the research we are doing, we have demonstrated that we can improve cognitive and brain functionality and functionality in general in normal aging individual. We have done already on stroke. Now we are trying to push the boundaries even further. We want to see how much damage can be that can be still reversible. So for example, we have a study now on what we call prodromal Alzheimer, people who have significant cognitive decline. In PET scan that we are doing to the brain, we see the amyloid in the brain. People can still stay in informed consent, understand what we are speaking with them, and we want to see whether that point is not too late, whether at that point we can still reverse the early Alzheimer. We don't know the results of that yet, but that's what we are trying to do. We try to push the limits forward and see what is the unreversible turning point where we cannot take or improve the brain tissue anymore.
Cool. I will be watching out for any papers on that. Okay, so people can get the book anywhere. It's released now? It was released beginning of October?
The book is released and people can just order it in Amazon.
Right.
And in the book, we discuss enhanced medicine. We discuss not only hyperbaric, we discuss all the elements that the way we practice or see that medicine should be practiced and is being practiced by our team.
Right. Yes. Not aiming for normal. Yeah. I mean, it's a kind of little diversion, but yeah, I mean, like the normal blood markers and so on, they're all measured by looking at what normal people have. That doesn't mean they're optimal. And so really, we want to find what the optimal numbers are.
Yeah, especially the normal for age. Who wants to be normal for being 80? You want to function. You want to be at your best.
Absolutely. Yes, we want to be normal for an 18-year-old, a healthier 18-year-old. Okay, Dr. Efrati, thank you so much for joining us today. It has been great talking to you.
Thank you.
Thank you.